As we age, many of us develop aches and pains, particularly in the knees, the hips, and the low back. Oftentimes, one thing is overlooked causing these aches and pains, and we're talking about the glute muscles. And how does that go, Mike?
We're going to talk about gluteal amnesia, also called dead butt syndrome.
Dead butt?
Dead butt.
Okay,
Sam's just dead and overall, but he doesn't even have a butt. Anyway, we're going to talk about how your walking technique can really affect this and some simple changes you can make at home to make your walking less painful and feel better.
That's right. We'll go over the details using Sam and then the exercises to correct it.
Bob and Brad, the two most famous physical therapists on the internet.
Welcome to the Bob and Brad channel. We are the most famous physical therapy team on the internet.
In our opinion, of course.
Our goal of this channel is to help you stay healthy, fit, and pain-free. And if you find this video beneficial and you like our weird banter, please subscribe.
There you go. And we also have Sam here. We're going to use his backside. We're talking about gluteal amnesia. What does it mean? If you're a therapist, you probably know. If you're not, we're going to clear it up. So we're talking about hip muscles, the glute muscles. There's three of them. The minimus, the medius, and the glute max. We're talking about the glute maximus. As the name implies, it's the largest of the three. It connects here right where my fingers go and also connects to the hip, the greater trochanter. When it contracts, it actually makes the leg or the hip extend or go back this way, which is really important for walking and keeping the hip joint working properly.
Yes, your glutes actually help stabilize your pelvis, so it means they keep nice and neutral. It also can help reduce stress upon any joint pain you are experiencing, because most people nowadays walk with a heel strike foot way out in front of them. So later on, we're going to show you kind of how to walk correctly to engage your glutes, because if your glute max is doing the work, which is a big, strong muscle, it's going to take a lot of stress off of those joints.
That's right. So you may wonder, why does the glute maximus have amnesia or is not working? One of the theories is if you do a lot of sitting, which actually in society today, we sit a lot more than we used to 50 to 100 years ago, at work, at home, etc. That's just one of the theories. There's some other ones. We won't get into that.
We also sit on higher surfaces compared to what we used to, because most people sit on the ground, especially in other cultures. So you actually get more glute engagement there. Anyway, I digress.
There you go. Let's go on.
So the first thing we want to talk about is actually how to strengthen your glute muscles. Now we're going to show 3 exercises. They're all a little bit different, so make sure to try them all out. And the first one, we're actually going to work on the glute medius and minimus, which are your lateral hip muscles. They keep you nice and upright when you walk. If they are really weak, you may see some people with a waddle walk, or they kind of sway a little bit. Oftentimes, this is due to weak glute muscles on the lateral aspect. So for this, you can stand behind something for support if needed. You don't have to if you feel well balanced. And you're just going to kick your leg out to the side. And notice my leg that is standing, I have a bent knee. This is going to make these muscles work a little bit harder. And then we're going to do about 15 repetitions on one side and then switch to the other and do that for 2 sets. If you need to break it up differently, 3 sets of 10, want to do all 30 at once, do whatever you feel. If this seems way too easy for you, you can certainly add resistance. You can grab a large band like that. You can grab a little loop band as well, and then just, oh, fine. I'll get the big loop band then. You can have that one. So put them on, and then you could do it standing like that. Up at the knees will be a little easier than at the ankles.
Okay. 2 big things not to do is let the upper body go like this, keep it steady, and then if your toe points out, which is a real common propensity for someone to do if they're not thinking about it, point it in and keep it there. Good, meaningful movements, not flopping it around.
You can use a band like this as well. Just make sure it doesn't slide out from your foot. The higher or more tension or the harder resistance, the more challenging it will become. Or if you have a cuff weight, which is just one of these little strap weights, you can just put it around your ankle and do it that way as well. But I don't think I need to show it. It's getting a bit redundant.
Yeah, redundant.
The next exercise are glute pumps. So we're going to isolate the glute max. You can do this in a kneeling or standing position, so whatever you feel comfortable with. If you are doing this in a kneeling position, go down on your forearms, and then you're not going to do the full range of motion that we normally think of when we think of glute pumps from a therapy perspective. We're just going to pick an area in the middle range about here, and then we're going to do little oscillations. We picked up this tip from our friend Rick Olderman, who's a physical therapist. He talks about this issue a lot. If you're not feeling a whole lot of contraction in your butt muscle and it's all in your hamstrings, try turning your foot in and you'll isolate the glute max a little more. Again, shoot for 30 repetitions on both sides.
You don't have to have an ankle weight on with that, but you can. If you want to do it without kneeling, you can certainly do it standing. Have a solid cupboard or something to lean on.
Countertop.
Put the leg just like this, same thing, and we're not doing great big swings. It's, again, extend up a little bit and about 6 to 12 inches of translation there like that. You can rotate in to help isolate that glute maximus, and that's what it's all about, is that glute maximus getting stronger. It's probably the most important exercise.
Another exercise you can try is more of a compound movement, meaning it's working numerous muscle groups. So your glutes are engaged, so is your core, your hamstrings, quads, etc. So you're going to do a bridge. There's lots of variations of bridges you can do. For beginners, maybe put your hands on the mat table, both feet down. You're going to squeeze your butt cheeks together first, make sure your core is tight, and then you lift up and hold for about 3 to 5 seconds, and then come back down nice and slow. We're going to do 30 repetitions total. If you start to get more advanced or you're younger, you find this way too easy, you can take your hands out of the equation. You can put a band around your knees as well if you want, and work on pulling apart as you go up as well. Oh, Brad's got one.
Because I care.
Oh, that feels really nice on leg hair. Anyway, pull out and then go up, hold this way as well. If you don't have a band or don't want to do that, or it's still too easy, you can certainly just go to one leg and do it this way. But if you're older and this is problematic, you don't have to progress to this.
Yeah.
Fuzzy in the hair. Where'd that come from?
Why? These are probably best done on a carpeted floor. You can do them in bed. Sometimes that's a little soft for that.
I should wear pants or shave your legs. Anyway, the last thing not the last thing. The next thing we want to talk about is your walking technique, because this is where you're going to get the most bang for your buck. Say you walk 10,000 steps a day, like they recommend. You are constantly not engaging your glutes if you're walking improperly. So what we suggest is at home, take your shoes off, do it barefoot or in your slippers. If you have zero drop shoes like I do, you can wear your shoes like that. We'll talk about footwear in a little bit. But most people, when they walk, they put their foot out in front of them, they heel strike, and then they come forward. This whole aspect of walking, my butt is not engaged at all right now. It's back here. Your butt extends, so you're way out in front. You're not engaging. I start to engage slowly later on about here, but it's not as much. So what you can try and do is just take a smaller step. You can either land on your forefoot or just with a flat foot, but don't let your foot get so far out in front of you. Your foot should land beneath your body as you are walking. A way to feel your contraction of your glutes is walk your normal way. Put your hands on your butt. See how much your glutes are engaging. If you don't notice much, go the extreme opposite on your tippy toes if you can, and you should feel your glutes engaging way more. You don't need to tiptoe walk the rest of your life, but just slowly get your feet down to the ground flat and walk this way.
Yeah. I watched a video on Rick, and he was saying, if you can't feel those muscles, use your fingertips and kind of push in a little bit so you can really get a better feel for that. Anyways, it's just something you can think of, and I want to present options.
Yes, those are options.
That's my job.
So take your time with that. It's going to feel a little awkward because you've been walking the same way most of your life. You'll notice a big difference when you do it barefoot versus in shoes because you don't have all that cushioning on your heels. That's why people most often heel strike, because they have too much cushioning. So it's important to look at your footwear as well. As I just threw my shoes over here, I'll go grab them.
While he's doing that, I just want to mention that we've had people, and I've done it myself, if you have knee pain every time you walk, and then you try and really think about walking on your forefoot with a slight bend in your knee like you had mentioned, there's a good chance that knee pain is going to decrease immediately when you do this. We call it soft knee walking. Give it a try. It's very impressive.
The last thing to look at is your footwear, like I was talking about.
yeah.
Oftentimes, something with 0 drop. So that just means the forefoot to the heel is the same height off the ground. These are 0 drop, but as you can see, there's a running shoe, so there's still a lot of cushioning. Brad's got some more minimalist styles on. There's tons of companies, tons of brands. These are ultras, but these are expensive running shoes. Wittin is a pretty inexpensive brand from Amazon. Wittin. They're like $45 if you don't want to spend a lot of money. I have a pair that I wear for work all the time. I've had them for like a year. They're pretty reliable. I mean, I won't run in them, but...
Yeah, and just for walking, that's a good idea. Just make sure you got the 0 drop. You know, if they say they're 0 drop, they will be equal heel and forefoot thickness.
Other things they have oftentimes are wide toe boxes. That's not as pertinent to this video specifically. That's more for foot issues, so I won't get in depth. We have plenty of videos talking about this in detail. So those are all your tips to how to make walking less painful. So make sure to engage the glutes, change your walking pattern, eventually change your footwear, but take your time with it because it does take a while to adapt to footwear like this. So don't wear it all day long, just progress slowly.
Right. So obviously this gets a little bit comprehensive and I don't know if it's complicated, but once you go through this, you may have to go through this a few times, figure out, you don't have to do all these exercises, but I would certainly do the soft walking and check your glutes. Make sure they're firing with either the bridging or the one on your knees or this one, you know. Those are, well, would you agree with that, Mike?
Yes, pitch. Pick which exercises you feel the most glute engagement with. You can certainly do them all, but after a while, just pick the one that you feel is the most beneficial. The most important thing, I think, is just changing your walking pattern because that's going to have the biggest impact on your joint health.
Or less impact compared to heel striking.
Technically.
So what about another video? We got 5 new leg exercises seniors should add daily.
Yes, you can click the video link on the screen. So maybe you're trying this, but your legs are still a little weak. You can try out some of those exercises.
There you go. There's more than one way to exercise a muscle. That's the old PT saying. Be careful and have a good day.
Better jokes.
Yeah.
Bob and Brad, the 2 most famous physical therapists